take a look at some diseases of the respiratory system. Again, this isn't going to be a comprehensive look at all potential diseases of the respiratory system. We are going to look at some that are related to medical terms and some very big common diseases that you see. First up, you have COPD, and you can see on the slide on the right here that stands for chronic obstructive pulmonary disease. Okay, the one that is pictured here is emphysema. And what is happening here is that we are destroying those little end sacs at the end of your lungs, those alveoli that we take a look at. And if you need to review that video, please review that video. But once you destroy those very end sacs or those alveoli and they die off, there's not much we can do to get those back. And they are no longer able to do their function, which is to exchange oxygen or to get oxygen into your body. Okay, if they're no longer able to do that, we're not going to have enough oxygen to support our life. Okay, so emphysema is just one type of COPD. There are others, okay, that exist. But again, we're looking at the big picture here. Next up, okay, is a pneumothorax, In order to really understand this one, let's first break down that word pneumothorax, just so that you can see that the medical terms are going to lead you to the correct definition. Okay, so pneumothorax, break it down. If you need to pause the video, and then we will do it together. Okay, so there is no prefix in the term pneumothorax. However, the root term here is pneumo, which refers to the lung and air in the lung. And the suffix here is thorax, which refers to the chest. So the term pneumothorax refers to a chest full of air. You might be thinking that this is a little confusing. Isn't there supposed to be a little bit of air in the lungs? Let's go back to our picture real quick. Okay, so here we see our lungs sitting inside the pleura underneath the ribs. And you can see this one here, it's the left lung, okay, is collapsing a bit. Because what happens is the air should be inside the lungs physically and not surrounding the lungs in the chest cavity. And so when we talk about a pneumothorax, it's air around the outside of the lung, and it starts to create too much pressure and it causes that lung to collapse. Okay, so you can see the air from the outside of the lung pressing in, even though it's still inside the chest cavity. Next up, we have bronchitis. Again, let's break down the term bronchitis because it's going to give us some really good clues as to what's happening to this particular patient. Okay, so here's the term bronchitis. Go ahead and hit pause if you need to and break down the term bronchitis. All right, there is no prefix in the term bronchitis. The term broncho refers to the bronchi. So we looked at the bronchi, and if you need to go back and rewatch the video for the parts of respiration to know what the bronchi are, please do so. The suffix here is itis, which refers to inflammation. So bronchitis is inflammation of the bronchi. Okay, and it's not just inflammation, but let's take a look at that picture again. So it is inflammation, and there gets to be this nice little mucus buildup that lines the tubes of the bronchi where air should be flowing through to get to the alveoli to exchange some oxygen. Okay, last up, I'm showing a picture here of a nebulizer. I know we're in the disease section. This isn't really a disease, but this is something that we commonly use to treat asthma, COPD, bronchitis, and a lot of our inflammatory lung diseases. And so if you look up the term nebulo, okay, you will see it refers to a cloud. So what happens is this little mouthpiece fits right over the nose and mouth. It creates a little steam with medication that steams up. Patient will breathe it in, and this will help to open up some of those airways and passages and to treat some of that disease. Okay, let's break down the rest of that term. I've given you a little hint, but make sure you use your word list. Let's break down this whole term. Okay, so in the term nebulizer, there is no prefix. If you listen carefully, okay, to that previous picture, the term nebulo referred to a cloud. And the suffix izer, I-Z-E-R, means to affect in a particular way. So the nebulizer affects in a particular way with a cloud. And again, it's more steam that is sort of created, right, so that the patient can breathe it in easily. Again, another look at that nebulizer, right, that fits over the nose and the mouth so that we can get medication into our patient.